What are the diagnostic tests that are needed to confirm if you need a hip replacement surgery? In our practice, we have been doing hip replacement surgery for three kinds of conditions. One is hip AVN, the avascular necrosis of hip. Second is fracture of the neck or femur, in which the hip joint has broken. And the third is developmental dysplasia of the hip, a condition in which the hip has not developed properly. If we talk about the patients who have been suffering from avascular necrosis, we do X-rays and MRI to study the stage of the disease, and based upon the stage of the disease, we decide whether the patient needs medical management or hip replacement procedure. For the patients with the fracture of the hip joint, we normally need X-rays, and sometimes if the fracture is very complex, we also get the CT scan done to plan the surgical treatment. Coming to the third part, developmental dysplasia of the hip. These patients are very young, mostly in 20s, and they have been living with bad hip joints for the first 2 decades of their life, and in these patients there are major bone losses also. So we have to plan it in a very diligent manner, and for this we always do X-rays and CT scans of the hip joint to ascertain the right surgical technique, the correct surgical implants for them to get the best results. However, just like any other surgical procedure, apart from planning for the surgical procedure itself, we also check the fitness of the patient for the surgical procedure, for which we do certain blood tests to check the hemoglobins, the liver health, kidney health, lung health, heart health, and everything to ensure the patient does not get any complications, any long-term implications which are not good for them because of the hip replacement procedure itself. And all these precautions, all these specializations have helped us in changing lives of thousands of patients who have not been able to walk properly, work properly, live their lives properly because of the damaged hip joints. Having a damaged hip joint is a debilitating condition which can actually push you in the bed. It can prevent you from walking, from turning, for doing anything that a normal human can.